Good morning, everyone. May is the National Trauma Awareness Month. And today is actually Trauma Survivors Day. So this is the first time we're doing this event here at Brookdale as part of the OBH family. And I welcome all of our hospital leaders, our community leaders, and most importantly, our patients and patients' families that have endured life-changing uh, uh, incidents over the last several years, and some of them are graceful enough for us, to share their journey with us today. So we have a lot to learn from their journeys and how we can be better. And I want to start by saying thank you to Sharon and Nicole. A big round of applause for both of them. I don't know how they do it. They transform this into, a non-Brookdale kind of edifice. It's like this is not something that we're used to. So it's really, really great to see Sharon, Nicole. Thank you very much. I think Ms. Brown was on a meeting until 10 o'clock at New York, Greater New York Hospital Association, so she may be on the Zoom. So I want to thank her for guiding the system through a really troubled financial waters, and for us to be able to function and then have days like this. I really thank her from all of our department. And Dr. Scott, thank you for your steady leadership here at Brookdale, and be a real steadfast partner for us, and I can't thank you enough. And there's many other leaders here from nursing, from nutrition services, from administration. Leo is here. Everybody else, we cannot be doing a lot of the things that we do in the department without your support. So I always say, it's when we're talking about residents, it takes a village to raise a resident, and it takes a whole village to take care of a patient. And the successes that we have in front of us couldn't happen without all of you in the room. From nursing, from our ED colleagues. Jeff is here, and our radiology colleagues, our nutrition colleagues, our nursing leadership, and all of our nursing in the operating room, in the ICU, in the PACU, on 11 CHC. Every one of them are equally important when everything goes right. So there's so many different points of care that have to go right for the successes that we're celebrating today. So thank you for all of the teams that make a trauma service possible. Thank you very much. And of course, our trauma program wouldn't be the program it is without our amazing faculty and our amazing group of residents. These guys, they work tirelessly day and night, and they work as a team, and some of the things that they do when nobody's watching is what makes me proud. So we all should be proud of our faculty and our residents. Thank you. So we gather here today to celebrate our trauma survivors, our patients and their families who have gone through a life-changing event, and we became a part of their journey. And it's an emotional day for a lot of them and us. And this is the first time we're doing it, and hopefully we'll be doing this, making this an annual event to celebrate our trauma survivors. So thank you for being here today and willing to share your stories. Thank you very much. And we're also going to celebrate the life of a true Brooklynite, a trauma icon, Dr. Patricia O'Neill. Her family couldn't be here today, so we from OBH are going to give a small award, and we'll send it to them. because of the time of the year, all of the families involved in many different events, so they couldn't be here today. This is a remembrance of her commitment to Brooklyn, commitment to Brookdale, and her commitment to trauma patient care. She's a true icon, and it's a legacy that we're going to be, working towards, continuous betterment of her legacy. So it's a day to remember her. And one of my mentors, he used to always say, in medicine or any other professional service, we are driven by the clarity of science. Without science and the clarity it gives us, we cannot do a lot of the things we do. And it also is driven by, the strength of our own experience. Each of us bring our own experiences to any event. So patient care, we bring our own experiences to it. So that's the second part. And the third part is your own faith in whatever you're doing. And Dr. O'Neill really embodied all three of these facets that are required for any professional to be successful. And she brought it every single day and applied all three of them in caring for every trauma patient that she came across. So I'm really glad that I was able to be part of this amazing team here. And without any further ado, I'm going to pass it on to one of our young trauma leaders, Dr. Roy Lacey, who's going to be our MC today. So a big round of applause to Dr. Lacey.
Thank you, Dr. Couture. Ladies and gentlemen, distinguished guests, and resilient survivors, welcome to our inaugural Trauma Survivor Day. We gather to honor and celebrate the unwavering tenacity and strength of those who have triumphed above adversity. Trauma is an unfortunate reality that can strike anyone, regardless of age, gender, or background. What truly sets survivors apart is their unwavering ability to rise above the challenges as symbols of strength and healing. We also wish to extend our heartfelt gratitude to the diverse departments that form the backbone of our trauma team. It is through their dedication, tireless efforts, and collaborative spirit that we achieve the successes that we celebrate today. And once again, welcome to our first annual Trauma Survivors Day, and thank you for being part of the celebration. Before we begin, I would like to introduce a man whose faith and compassion has touched the lives of many. Pastor Belton is the founder and senior pastor of New Destiny Church Ministries here in Brownsville. With his deep-rooted commitment to faith and the well-being of others, he's a pillar of strength within our community. Please join me in welcome as we invite Pastor Belton to offer words of reflection and guidance in an opening prayer.
Good morning. It's so good to see you all. And we honor our trauma survivors. Trauma is serious, and it can manifest itself in your life in many different ways. Trauma can either bring families together or destroy them. But this morning, I just want to offer up a prayer of healing for our trauma survivors. Would you all bow with me as we pray? Father, we ask that you would heal survivors of any physical trauma they have endured. God, let miracles of healing happen in survivors around the world. Bring mental healing to each victim. God, help survivors to see themselves as you see them, as healed and restored. Remove any lies they have believed about themselves and others through the trauma they have endured. Heal them of any trauma. Remove fear from their lives, that they would know the perfect love that comes from you. Give them new hope for their lives and the future. Help their minds be free and renewed from any attachments to the past of their brokenness. If they feel any shame or guilt, let them understand that it's not their fault. We pray this in your name. Amen.
Now, ladies and gentlemen, it is my honor to introduce the esteemed Executive Director of OBH Brookdale. Dr. Sandra Scott is not only a highly accomplished physician, but has also achieved a significant milestone in Brookdale's history as the first woman, physician, and person of color to hold the position in our 100-year history. Dr. Scott is an inspiration to us all. Her presence today is a testament to her understanding of the profound journey of a survivor. Her insight has helped to guide us through the complexities of healing and recovery. Please join me in welcoming Dr. Scott.
Thank you. Thank you so much. Thank you. That was really beautiful. Good morning, everyone. How's everybody feeling? So I want to welcome you on behalf of the executive team of One Brooklyn Health in Brookdale to our auditorium to celebrate not only our survivors, but all of us. And I think, Dr. Kuthuru mentioned that it takes a village and a team to bring healing forward. And it takes trust, right? You have to trust in us that we will take care of you and your family. We have to trust in each other. I'm an emergency physician, and I've only worked in trauma centers over the past 20 or 30 years of my career. And I can tell you from personal experience, right, from the field when the EMS providers bring in patients to the emergency department, the emergency team, the trauma team, and all through the journey to healing, right? And so we want to celebrate these successes because not everyone was able to be here with us today, right? And so this is a time for us to celebrate the Brookdale family, including our community, that come together to bring forth healing. So welcome, and I look forward to celebrating with you today. Thank you so much.
Dr. Jason Hirschberger is a distinguished leader in the field of psychiatry. He's someone who has dedicated their expertise to understanding and addressing the psychological impact of trauma. Dr. Hirschberger serves as chair of the psychiatric department at OBH Brookdale, a position that highlights his knowledge, experience, and commitment to mental health care. His department works closely with the trauma team, recognizing the crucial importance of addressing the psychiatric toll that trauma can inflict. Welcome, Dr. Hirschberger.
Thank you. Dr. Kuthuru, I did not know that May is Trauma Month, Trauma Awareness Month. May is also Mental Health Awareness Month. So maybe that's why I'm here. I do want to say it's such an honor and a privilege to be part of this team, to work with survivors that have been through everything, to work with a group of skilled surgeons and nurses and the rest of the disciplines. It's really a privilege and an honor of my career to be here with you now. So thank you. One of the things I want to highlight is this family, this group, this village, how you want to describe it, takes on the whole person, not just the physical injury that requires physical healing, but sometimes the spiritual injury that requires spiritual healing, as you heard from our pastor. And I guess I'm here to talk about the possible emotional injury that can happen in the course of an unexpected trauma. Now, the thing I want to emphasize is that the human mind is really strong. It's really strong. It can deal with the unbelievable. It can endure what seems like the unendurable. What the folks in this room have been through can be an unimaginable experience to most of us, but they're here. They made it, and they're recovering from it. All kinds of injury. Now, the wonderful sensitivity that this group has towards the emotional component, the emotional part of trauma is really great. I just want to say, first of all, human minds are incredible, and we can endure much, but trauma hurts. It hurts us emotionally, and there can be scars that you can't see. Scars are invisible, scars that are on the inside that need support and help. Now, that support and help can come from loved ones. It can come from patients. Everybody needs those things. And for many of us, that's enough, but not for all of us, because not every person and not every injury is the same, and they all have to take their own course. So sometimes when people have been through a trauma, they can go through, well, actually everyone who goes through a trauma has an emotional reaction to it. Some of us will have an intense emotional reaction to it that can cause feelings that are hard to manage. And I just want to go over some of them so you know they're A, normal, and B, what to do about them. So one feeling can be fear, another can be anger, guilt, shame. Those are the things the pastor mentioned. There's a whole soup of feelings that a person can go through. That in the period after a trauma, it's work. It's emotional work to get through it, to process those feelings, to share them, to settle them in ourselves so we can move on. But we do it. We get through it. Every once in a while, it's harder to get through. It can be hard to get through. And when that happens, if those feelings of being overreactive to triggers in the world, to feeling anxious when there's nothing to be anxious about, to feeling on the edge of losing your temper, or feeling on the edge of losing the stability of your mood. If that happens, we have a condition called post-traumatic stress disorder, right? Where people can feel the emotional injury of a trauma and it can linger, even when the physical recovery, even when the spiritual recovery is taking hold. And when that happens, there's treatment. There is really good treatment for it. Talking to someone, therapies, and sometimes even medicine can really help people recover. So I say that most people in this room know that, but it bears repeating that getting treatment of the emotional side is really important to full recovery, because that's what this village is all about. So again, I want to thank you for the opportunity to spread that message, and please share it to other people so more people avail themselves of treatment when they need it. Okay?
Dr. Rami Abdelnabi is a remarkable individual who has dedicated his expertise and passion to the care of the injured. He's not only a shining star within our program, but a close friend and colleague. His unwavering commitment to patient care has propelled him to the forefront of trauma medicine, and Dr. Abdelnabi has taken the reins of our trauma program. His energy and innovative mindset inspires us daily to strive for excellence. Please join me in welcoming Dr. Rami Abdelnabi.
Good morning, everybody. Thank you for coming. So today I want to talk to you guys about what it takes to care for the injured patient. Today we're celebrating not only our patients, their families, but all of the individuals, the staff members that really have different parts to play, some big, some small, but all equally important to ensure that patients in our hospital, in our facility, are well taken care of, and we put them back on a road to recovery. Brookdale is going through a lot of different changes. And when we're at the when we come up to pivotal moments, critical moments in our growth, it is important to just take a step back and think about where we were, where we are now, and where we're going in the future. And so just a brief history about Brookdale. Brookdale has actually been taking care of injured patients for over 42 years. Back in 1921, when this hospital began as Brownsville and East New York Hospital, it later became Beth El, and then in the 60s became Brookdale Hospital, and became the building and the institution that we know it today. Also in the 60s is when, in 1982, that's when we became a level 1 trauma center, before ACS verification at the time. And in 2016, we became a level 2 trauma center verified by the American College of Surgeons. In 2016 is also when we joined under the umbrella of One Brooklyn Health, joining Interfaith and Kingsbrook Jewish Hospital. Currently, we service the area of Brownsville, Canarsie, and East New York. But under the umbrella of One Brooklyn Health, our reach expands even further. In 2021, we opened a brand new state-of-the-art ICU. And in 2022, and I want you to pay attention to some of these numbers. In 2022, we saw almost 2,000 traumas coming through our emergency rooms. 556 of those traumas were level 1 traumas, which is the highest activation criteria, the sickest of patients. And out of all of those patients, 461 patients were victims of some penetrating injury, whether that was a stab wound or a gunshot injury, some penetrating injury. That's nearly 25% of the patients we see. It's a big number. That tells us that we have a lot to do in our community in terms of safety, in terms of injury prevention. So where are we going in the future? Number one, our goal is to upgrade our institution to eventually be an American College of Surgeons Level 1 Trauma Center. We also are planning on building a brand new state-of-the-art emergency room. And we really are pushing and want to become the premier academic trauma center in Brooklyn because this community deserves it. When you look at who takes care of trauma patients, it starts all the way from out in the streets. When you are dealing with NYPD and EMS, and then you come in through the emergency room, you meet a whole bunch of people, the trauma team, the radiology team, the building services, radiology, and the list goes on. And what you realize is you have over 15 teams taking care of you to put you on that road to recovery. So today, my friends, today is an opportunity for you to hear some inspiring stories, to meet some of the people that help take care of you, and for us to build trust together as an institution, as a healthcare team, with the community as well. And I'll leave off with this. A famous and wise man who recently passed away said, "We're all the same. We all want to be happy. We cry when we're hurt. We're angry when we've been mistreated. To be liked, accepted, respected, and loved is the greatest gift of all." Thank you.
Dr. Nicholas Vicari is a trusted and esteemed figure within our institution. As chair of emergency medicine, he serves as a beacon of leadership in the critical initial moments of trauma care. The emergency department is the first line of defense and gateway to life-saving interventions. His leadership and teamwork have been instrumental in ensuring our emergency department operates with efficiency, precision, and commitment to patient care. Welcome, Dr. Nicholas Vicari.
Good morning, everybody. I want to just tell you, the first time I got an interaction at Brookdale, 2005, and I was a resident here at Brookdale and rotating through the emergency department, and it really hasn't changed much in that the people who are here and the human part of the way we care about patients is one of the best I've seen. And for the past 18 years, I've been at New York Presbyterian. And I can tell you this, in my last 4 weeks here, I have come to meet some fantastic clinicians. I've come to meet fantastic nurses, people that are taking care of everybody throughout this entire process with very little. You know, I feel a lot of gratitude being able to be here with this team. And one thing I just want to add upon what Dr. Abdelnabi said is really about building trust in the community. And that's something for our emergency department. It's so important that we start to build those trusts. And what does that mean? How is trust built? And trust is built through our community partners. Trust is built through our EMS partners. Trust is built through our NYPD partners. A couple of months ago, there was the misfortune of one of the officers getting shot in the head, not too far from here. And I had the opportunity to speak with Keyshawn Sewell, who's the police commissioner. I also do work with the NYPD. And as we were talking about this case at another hospital up in Jacoby, one of the things that she said to me is that she felt like she was family here. And the other cops felt like they were family here. And then I thought about what that means. You know, what does it mean for people to feel like family in one of their most vulnerable times. And that's something that the commitment for the emergency department, from the nurses, from the doctors, but also from the people who register you, from the transporters, from the people who are cleaning, because if the place isn't clean, then I'm not even a good doctor. So I'm only as good as those folks who are coming to see you as well. And that's what we're trying to build. We're trying to build that interdisciplinary team that's able to build trust in the community. I think with Dr. Abdelnabi's leadership in the trauma team and the rest of the trauma team who's back there, heroes don't wear capes here, okay? They come to work every day. And I'm truly blessed to be part of this team now. I look forward to this future, and I'm looking forward to a glow up in Brownsville. I'm looking forward to the rest of Brooklyn and where I grew up in Brooklyn also. And seeing the rest of Brooklyn glow up, I want that glow up to come here to Brookdale, to Brownsville, to East New York. Not just stay over by Bedford-Stuyvesant or over by Troy Avenue, you know, to come down throughout Remsen, throughout Linden. And I look forward to that time and seeing that come to fruition. Thank you so much for having me. Thank you for including me in this. Have a great day.
At this time, I'd like to invite Dr. Torlani and Dr. Abdelnabi to the stage. It is with great honor and reverence that I introduce our cherished former chairman of surgery, the embodiment of wisdom and experience. With 54 years of experience as a cardiothoracic surgeon, Dr. Anthony Torlani has dedicated his life to mending hearts and providing compassionate care. His commitment to excellence has left an indelible impact on Brookdale. Please join me in welcoming Dr. T, as he honors the memory and legacy of our beloved former trauma medical director, Dr. Patricia O'Neill.
Thank you for this opportunity, and thank you for you folks surviving and being here and sharing this day with us. Also, when Dr. Kathura asked me to do this a few weeks ago, I would tell you all to remember, the first thought I had was, what an honor that is for him to ask me to do this. Whenever you think the chairman of surgery is doing you a favor by asking you to do something, think again. Because I don't even know what a humanitarian is. So at first I know her, I knew what she did, but humanitarian, what does that mean? So I wrote it down, and last night, in the last several days, I got it out of the dictionary, and it was just hard for me to remember. So excuse me for reading the definition of humanitarian that comes out of the dictionary. And now I wear glasses. It's a person devoted to promoting the welfare of humanity through eliminating pain and suffering. And then I said to myself, okay, I get all that, but what does devoted mean? What does the word devoted mean? So I looked up the word devoted. Devoted is to give up oneself exclusively. Boy, that's a big thing. And then I said, how does she fit that? And then I said, well, what humanitarians do I know? I don't know any. What humanitarians have I heard of in the last, since this century? None. So I said, well, who are humanitarians? And then I remembered, from going to church, Mother Teresa. Mother Teresa took care of the poor and the starving. Humanitarian. Mahatma Gandhi saved a country from colonialism. Truly a humanitarian. And of course, our own Martin Luther King, who gave equality to a race that's been underserved forever. And that opened the door for women's rights and sex rights and children's rights. All that came because of what Martin Luther King started for a particular group of people. Those three people are humanitarians. And I looked at them and I said, well, they saved hundreds of thousands, if not millions of people. She didn't save 100,000 people. She came here and she's a trauma surgeon. What's the big deal? Well, the trauma surgeon saves lives. Not hundreds of thousands or millions, but individual people, individual lives. Under the most severe circumstances. And I apologize to the families and patients because I'm not addressing this to you. So some of this you could say, well, geez, why is he talking about this? Because I was asked to talk about her, so I apologize. But what she did affected all of you, all of us. We didn't forget Mahatma Gandhi. We didn't forget Mother Teresa. We didn't clearly not forget Martin Luther King. We should not forget Dr. O'Neill, especially the residents. So that's what a humanitarian is. Those are examples. What does she do? What did she do that makes her worthy of this award? What makes her a humanitarian? And I said, here's a woman who started as a nurse. Her mother's a nurse, her sister's a nurse from Brooklyn. She goes to downstate nursing school. She becomes a nurse, and she goes to Brooklyn College and gets into medical school. In my career of 54 years, there are 2 women that I know of who were nurses who went to medical school. 2. When she went to medical school at downstate, 200 students every year, when she went, maybe 10% were women. Downstate was not one of the big fancy Ivy League schools, but downstate was a state school. It was very affordable, maybe 20% of what it cost to go to a private medical school. Everybody who had any financial issue would go to downstate, even people who didn't. Unbelievably competitive. She goes to downstate. How many women in her generation went into surgery? Almost none. Maybe a residency program had 1 woman in those days. She stays at downstate. At that time, one of the best programs based on Clarence Dennis and Dr. Kuntz, and those people, a foundation of great research and quality. She does a year of research. She finishes the residency. She goes to Jacksonville, Florida, to do trauma and critical care. Why go to Florida? Dr. Shires, the father of trauma surgery in this country, who was the chairman at surgery at Parkland when Kennedy was killed, left there and went to University of Washington, left there and came to New York Hospital, Cornell. The father of surgery did the basic science research in hemorrhagic shock and the use of lactated ringers. He trained 2 or 3 stars. Savetta was one of them. He became the chair of trauma at Jacksonville. And she goes there. She went to one of the best programs in trauma critical care in the country, top 2 or 3. She's a woman, had done research, had gotten 2 NIH grants, trains with Savetta, go to any major academic medical center in the country, any medical school. She goes to Kings County. She goes to Kings County. Why? Why would she go to Kings County? She stays there, and she works and she works and she works. She ends up becoming the chief of trauma and a full professor of downstate. Great retirement plan, great pension program, set for life. What does she do? She leaves there and she comes here. To what? To what? She comes here, she's head of trauma. Dr. Abral had been the chairman of surgery. Dr. Brawl is going to leave, is leaving. She is the interim chairman. So they said to me, Tony, come over here, and why don't you be the chairman of surgery? Well, why? I'm about to retire. I'm not going to operate anymore. So I meet with Dr. Brawl. He says, I want to be a surgeon. I want to do heart surgery. I'm not interested in being chairman. I meet with Dr. O'Neill. She says, I'm the interim chairman. I don't want to be chairman. I want to run trauma. So I become the chairman. And I have Dr. Kuthura and Dr. O'Neill. Dr. Kuthura takes over a residency program that's in big trouble. She takes over a program in trauma. She has herself and the Dr. Toribio, who is a tremendous ally, has a fund of knowledge that's encyclopedic, and a very excellent trauma surgeon. That was it. He takes a residency program that's in big trouble and fixes it. We had people who were in the 20th percentile on the in-service exam. He could not let them finish this program because they would have failed the boards. He fixed that. Our residents have great research opportunities. They weren't doing what they needed to do. All those residents go to the major institutions in New York and do important academic research. So they can pass the boards because they have knowledge. They have research opportunities that are unequaled. What about surgical experience? Well, she's here with a trauma program. They take care of the sickest of the sick patients we'll talk about in a minute. And I meet the people in that division. Locum tenens, per diems, a pediatric surgeon, a vascular surgeon. What the hell? And she has to get a program approved, otherwise we'll have nothing. And she and Dr. Trivio and Dr. Lapenzina and Dr. Kothura form a foundation and begin to recruit other good young people. So now we have the faculty in trauma that's unequaled. And our residents, because they take care of these patients, from the time they're interns to the time they're chief residents, they're participating, they're learning, they're taking care of the sickest of the sick patients. And they go home, those patients. So when our residents apply for fellowships, why do our residents who come from all over the place get great fellowships? Because they got tremendous surgical experience, because they got research experience, and because they're smart, because if not smart, they don't stay. Those guys have built that. When the national organization came here to look at our trauma program, I was so worried. At the end of their visit, one night, after 3 days of hanging around here, they came to the conference room. They couldn't praise that program more. It was unbelievable. I was so proud of what they had accomplished by themselves. They did it under her leadership with no complaining, no saying, I need this or I need that or I want this or I want that. Did she ever do that? Yeah. Behind closed doors, I would listen. I couldn't fix it. And then when I gave her advice of what to do, she didn't want to listen. So I said, I'm just here to listen and keep my mouth shut. But it was done. Did it help the residents? Yeah. Did it help the hospital? Yeah. But it really helped the patients. I would sit at M&M and we present a case. And they'd say, well, patient came into the ER and he arrested. They resuscitated him. They got him back. Take him to the operating room immediately. Immediately. Survivability there, 5%, 10% maybe, on the table. A lot of hospitals, great hospitals, would have even gotten him to the ER, to the OR. They said, oh, he arrested, we'll get him back, but he's not going to survive. Take him to the ER, to the OR. arrests on the table. I'm not making it up. They get him back again. What are the chances of that person going home alive? 2%, 3%? Stop there. It's not, there's no hope. Let's stop, let's go talk to the family. No. We got him back. Let's do the operation. And there's a general surgeon doing the operation, but they find out they need a vascular surgeon at 3 o'clock in the morning. Vascular surgeon gets in there. Not a fellow, not another resident, the attending comes in. And then they realize we need a chest surgeon. So what happens? A resident comes, a fellow, an attending comes in. Nobody's looking at the face sheet to see what the insurance is. Nobody's looking at anything. They need me, I will go. That's what they did. And that patient walked out of the hospital. And I can tell that story once a week for 10 years. That's what that team did. And it started at the top. It started with her. It started with Dr. Toribio. And now we have this unbelievable group of young, academic, smart, dedicated surgeons, some of whom you've already spoken. You've heard them speak. Hospitals, great hospitals, are built on surgery. They're not built on medicine. Memorial Hospital was built on the reputation of the surgeons. Cleveland Clinic was built on cardiac, vascular, and colorectal surgery. University of Pittsburgh was built on transplant surgery. Hopkins was built on transplant surgery and trauma. Hopkins is in no better area of the city of Baltimore than we are here. Yet they're a great institution. We can be a great institution. And we have to build on these programs that are strong. And you have that right now, and much of it goes to her. What she did. She was dedicated to these patients her whole life. She could go on anywhere. She stayed here. She stayed in Brooklyn, and she came here. And I really believe, I never thought about it till you asked me to do this. Never dawned on me. Okay, she's doing her job. What she did, we should never forget. General MacArthur said, old generals never die, they just fade away. And that happens in surgery too. Great surgeons, Dr. Kuntz at Downstate, Dr. Shires, Dr. Spencer, Denton Cooley, we forget about them. Please do not forget what she gave to this institution and what she is giving and what you people continue to give to all these patients who deserve only the best. I went a little long, I'm sorry, but thank you for listening. So this is the award I'm giving to Rami, because you're going to give it to the family, right?
Yes, absolutely.
Okay,
Thank
good.
you.
Thank you.
Dr. O'Neill's family unfortunately could not be with us, but they wrote a little statement that I would like to just briefly read. On behalf of Dr. Patricia O'Neill's sister, nieces, nephews, and family, we thank One Brooklyn Health for this recognition. We all regret that we cannot be in attendance at Brookdale today, but please know we are zooming in. Our family is very grateful of OBH honoring Trish for her compassion, love, and commitment to her trauma patients. We are appreciative for the recognition she is receiving for her dedication to the treatment of some of these patients here today, the thousands she has served in the years past, as well as the deep responsibility she felt to teach so as to uphold and sustain excellent clinical care for those who need it at the most. We know there is a void within the surgical trauma department, both local to Brookdale and as far as the national committees she has served, which is another testament to the lifelong allegiance to her surgical trauma and critical care work that was so very important to her. As Trish's family, we are keenly aware of the sacrifices made by many to this intricate profession, and for that we extend a heartfelt thank you for all you do to provide care and quality of life to so many. Thank you again for this honor.
Joining us now are representatives from the organization Elite Learners. Elite Learners provides impactful services, including violence interruption, to our community. They will shed light on their pivotal role and in regards to support of the trauma survivors on their journey of healing and recovery. The representatives of Elite Learner. Thank you.
Good morning, everyone. My name is Melvin Jackson. I grew up in this neighborhood, and when I got a chance to, with my daughter, we started the Elite Learners, and we were trying to figure out how we could give back to the neighborhood. She's outside now. She suffered from sickle cell, and this was the hospital that we came to when she was young. And so she grew up in here on the fourth floor with Dr. Golf. And it gives me great pleasure to be able to come back to this neighborhood and to this hospital to help with all the trauma victims. I'm a little nervous right now. Matter of fact, I'm a lot nervous because I didn't know I was going to be coming up here. And I ain't never been this, I'm 62 years old. I've never been this nervous in my whole life. Now that I got that out the way, let me try to start all over. You know, and when, you know, we came here and we wanted to make a difference in the neighborhood, and we were part of the Cure of Violence. And I became a hospital responder. And my job here at the hospital is to deal with anyone who had gunshot wounds or stab wounds or been assaulted. It's real personal. Like, there's a young lady right here that when we first came here, we didn't really know what we were going to do and how it was going to work, but we knew that we wanted to do something. And she was in bad condition. She was in bad shape. And we was in the same room, and there was a lot of people, and I was saying, I hope they don't ask me to talk. And sure enough, they didn't ask me to talk that time. But my job here is to take a damage assessment or take an assessment of everyone that was shot or stabbed once they get to the 11th floor. And from there, we, you know, forward them to our resource. I'm so nervous, I swear to God. Y'all don't understand. Whew. I just gotta be me. I just gotta be me. So what I do here is, you know, I'll go upstairs and I'll meet the patients. Most of the time I know where the shooting has come from because I live in this neighborhood. So if they're shot in a certain area, I'll know the area or I'll know the people around there. So when I do come upstairs to meet them at the hospital, I'm already familiar but with, you know, where it happened at. So we already have a dialogue that we could talk about. A lot of times I'm finding out that I know their family members or someone grew up with me that's close to them or whatever like that. But it's been hard, you know, during the hard seasons, like the winter times when there, you know, like a lot of shootings and stuff going on and then going into the summer. But now that I'm here today, I don't know where I'm going with this. I'm just Judy, yeah, let me tell you. Well, anyway, our program here is, oh boy. Once I come upstairs and see them at the hospital, I do assessment, and then we refer them to all our different resources that we have for different help. We have a wraparound program that you know, we start on the outside and we try to stay with them until they're back to recovery. Like, there's a lot of patients here today that's doing great, that came a long way since they were first brought here. My job is more out in the field. I'm hands-on. You know, I deal with outside every day, you know, like the tough stuff that goes on. I just have to I'm have to get down right now. I can't do it no longer, Judge. I'm stuck. I'm stuck. I'm stuck. I'm sorry.
So at this time, we'd like to shift our focus to those whose experiences embodied resilience and the capacity to overcome. With me are 6 extraordinary individuals who have walked the challenging path of recovery. Please join me in welcoming our survivor panel. Thank you for coming. Okay. Ms. Outlaw, can you describe the circumstances surrounding the time of your injury, your initial reaction to it, and how you coped with it in the immediate aftermath?
I'm trying every day to cope. Last July, I was shot sitting outside in front of my building. I'm 75 years old, and I was shot twice here, just sitting outside. I'm trying to cope. I'm trying to deal with it every day. It's hard. It's very, very hard because I think a lot. Why me? Why did it happen? And I'm trying to get my life back to be able to function and, enjoy my grands, my great-grands, and I have great-great-grands. So, it hurts them and, my family and everyone to see that this happened to me. But it's one thing I do. I thank God for bringing me back. I thank God for letting me live again. And I'm just trying every day to deal with it. And as soon as I'm able to get myself together to walk better and to function better, I'm going into church and I'm going to thank God every day because if it wasn't for God, I would not be here. And to be shot at that age, it was very traumatizing to me. And I didn't think I was going to make it. My family didn't think I was going to make it. But I'm here. I've seen Mother's Days. I've seen New Year's. I've seen everything. So I thank God for this here because to be shot the way I was, it really traumatized me. And I was just sitting outside with friends, and he just came randomly shooting. And I'm on a walker, and I couldn't run. And all I did was bit my head down and started praying. And he shot me. He shot me. The second bullet knocked me off my walker, and I couldn't believe it happened, but it happened. And I thank God I'm here.
Ms. Carroll? When you suffered your injury, do you recall any specific thoughts or feelings at the time? And can you tell us how you were able to process those thoughts and feelings?
My initial feeling was like Ms. Ella, why me? The night that it happened, I was in shock because I do work for the NYPD. I'm a dispatcher. So I hear this thing every day. I know what's going on. So when it happened to me, I just went into dispatcher mode. My biggest thought and fear was being a burden to my family because I was like, if I can't learn to walk again, I don't want to burden them down. But I got through it with the help of my family, my aunt, my niece, my husband, and prayer, and especially Miss Judy, her trauma.
Thank you. Ms. Gumpat? How long were you hospitalized after your injury? And what was daily life like? Any particular challenges?
I was hospitalized. This was recently, October 31st, Halloween, until about December 10th. Then I was discharged and I came back for another 2 weeks in January. Since I've been discharged, life has changed a lot. I had to learn how to walk again, how to write again, how to speak again. I was shot 3 times in my knee, my stomach, and my hip. And I'd never thought that personally something like this would happen to me. And losing a close friend, a person, a partner also played a factor in it. So it's still like a grieving process. It's something that I still have to live with every day, knowing that I did lose my partner at the time, same day I had got shot. He died that same day and with less injuries. And just sometimes I have days where I don't want to get better, where I don't feel like it's not worth like just getting better anymore. So
Thank you for sharing. Sloan? Sloan? Mr. Sloan? Can you describe the injuries that you suffered and how they affected your life? Have you had to make any significant adjustments to accommodate them?
Yes, one more time.
Can you describe the nature of your injuries and how they have affected your life?
Well, I work for an anti-gun violence program, you know what I'm saying? So even on my off days, I'm still working, you know? So I live in Tilden Projects all my life. And just on this particular day, on my off day, you know, I decided to go get something to eat around 12 midnight, you know, a typical trip I normally do. Um, as I was leaving out of my building, it was like a guy was standing in the exit, you know, the mask the kids wear now, you know what I'm saying? So his face was covered up. So long story short, it's like, you know, he was standing in the exit. So when I left out, I knew it was like kids that normally come to my building and hang out, you know, chill in the hallway. So long story short is I went in the lobby to warn the kids about somebody standing in the hallway that I didn't recognize, you know what I'm saying? In the process of that, I'm thinking the shooter probably would have left from, you know, running into me, you know, get nervous or whatever, like, you know, whatever. But he was determined to do what he had to do, you know what I'm saying? So in the process, so I'm telling them like, yo, look, let me just show y'all where the dude was at for y'all could be, you know, careful, you know? So as I'm showing them where the guy was at, I'm walking up the steps. I'm like, yeah, he was standing right here when I got out the building. I looked up the next flight of steps. The guy was ready, like holding a gun right there, you know what I'm saying? And just shot. It hit me in my chest right here and exit my back straight through, you know what I'm saying? So that's what basically saved me, that the bullet went straight through. Far as like how it changed my mindset is that it happened in my own building. You get what I'm saying? A building that I lived in all my life, and nothing ever happened to me like that, you know what I'm saying? So the traumatizer is about it is that I have to walk past this every day, you know what I'm saying? So it affects me a little bit. You know, I move different now. I'm more aware of my surroundings now. Like I don't just open the exit no more. I'm looking around every corner. So yes, it's traumatizing still, but I'm just thankful that I'm still here, you know what I'm saying? So that's the most important point, that I'm here for a reason, you know what I'm saying? So I just want to thank God that I'm still here. So I appreciate it. Thank you so much.
Ms. Rogers. Ms. Rogers.
This is Shaquan. Tatiana. Miss Rogers didn't come. So Tatiana's here. And she said,
I see.
this is a nice guy, Jamal. He's here. He's in the audience, so he doesn't have to dress. So this is Shaquan.
Okay.
And Tatiana.
And Tatiana, can you tell us about any physical or emotional challenges that you faced during recovery and how you overcame them? No? No? That's all right. It's all right. Mr. Winston. That's okay. We're glad to have you with us. We're glad to have you with us. We're glad to have you with us. Mr. Winston.
She go talk for me. Okay.
Sure.
Good morning, everyone. My name is Ruth Sparks, and that's my daughter, Tatiana Sparks. She was coming from the laundromat and got shot on the left-hand side of the brain. And as the bullet hit her, it spent her, and it brought her around, and she got hit between the eyes with another bullet. But I could say, thank God she's here. I went to hell and came back. But every day, I was with her. One day, it was a bad snowstorm a couple of years ago. And they were saying, no, you need to stay home and rest and just relax for the day. She all right, they got her. She was in NYU. And I told my husband and my other sons and daughters, I said, we ain't doing this. So I actually suited up, face mask, sleds, and I went all the way from Dean and Howard, walking in the snow, to NYU Hospital. And I made it. Long I got to see her that day, in that snowstorm, I didn't have no problem because I knew I had faith and I had God with me. But thanks for having us and bringing us back some more. Thank you very much.
Mr. Winston. What has the road to recovery been like for you? Can you describe any significant milestones or breakthroughs that you've had during your recovery?
Yeah, so my recovery was a long process. I was in a motorcycle accident, and in September 7th, I got hit by a car, and it was pretty bad. The doctor said nothing was connected to my knee, so I had a floating knee. They had to do a blood transfusion and put some metal rods in my leg, and I had actually, after the first surgery was done, I had a long rod sticking out of my leg, and the pain was excruciating. I couldn't bear with it, so every other day or every day I was begging the doctors for all types of pain medication, and it came to the point where I started having a favorite type of medicine. It's called Dilaudid, if I'm not mistaken. So I called I was telling the doctors and nurses, I need Delilah. So I nicknamed the drug. I said, I need Delilah, just bring me Delilah. And they put me on an IV drip, and they said, we can't keep giving you, we don't want to. And I said, so they had me on a certain amount of dose, and I felt like it wasn't enough. And I guess because my body's getting used to it. And but not only that, I was in the hospital for 4 months, pretty long time. So I practically lived there. So I saw the pros, the cons, the craziness, the passionate stuff. It was some tough times in there because you got other patients that goes haywire, and oh man, I have too many stories. We be here all day. And that's what happens when you stay there for 4 months. So it was to the point I had my mother, my father, they here now. They came, they was my support. My friends, they was my support. Every day I had somebody come bringing me food because I couldn't deal with the hospital food. I'm not trying to say, but y'all all know. And I, sometimes when you see other patients go crazy, and I see what the nurses deal with, so I try to, understand what's going on with them. They have too many patients that they deal with. They overworked. So I try to, give them a better day. Like, I don't want to be part of the statistics of, oh, now I got to deal with this room. Oh, he's gonna go crazy. So, but when it came down to for the nurses and doctors coming into my room, they look forward to coming into my room because I just set a different type of atmosphere. Even my roommate, it was to the point where, I couldn't stay still. Like I needed to work out because the doctor was saying, "Oh, you gotta get your legs start bending, and because if you don't get it to bend, it's gonna get stuck straight." So I was like, "That ain't me. No, I gotta get out of this bed." So I had like 5 different roommates, and out of 5, I would say 3 of them, I motivated them to work out, to open up, to kind of. And to even like treat the nurses a little different, just like sometimes you don't have to be hostile, if you be nice to the nurses, they gonna look out for you more often, they gonna be willing to come to your room, so, you know, shout out to Miss Edwards in the back. She was one of my favorites. She did a good job. And what was I don't know. Like I said, I have a lot, but I'm gonna just leave it right there. But thank you.
Ms. Gumpot. Can, hmm?
Did you want to see if Jamal just wanted to share anything?
Oh, sure.
I don't know. Did you want to share something, Jamal?
Yeah.
I'll bring the mic.
No, I got it. Thank you. Yeah, sure. Please. You can just talk if you like. If you have anything you want to share, say. Tell us what happened to you.
Good morning. I would like to say the entire trauma team at Brookdale, like the doctor said earlier, heroes, these are heroes that doesn't wear capes, come to work every day and do their job. My situation on August 7th, I was shot 14 times. Yeah, 14 times. I was shot twice in my chest, 3 times in my upper torso, 3 in my left arm, and the rest in my left leg. From the cops coming to my aid the night of the incident, to the EMT bringing me into the emergency room, I can only say I was well taken care of. Since that incident happened, I've shared this story many a times, and every time I share my story, or I should say give a testimony to what happened to me, each time I cried, but today I just feel a sense of bravery. To the surviving victims up here, to the ones that experience gunshot wounds, I get asked a question a lot, what it feel like to be shot? And the only response is that you feel the first bullet when it hits you, but everything else becomes numb until recovery starts. And it's a humbling feeling to be here today, be part of this seminar, and to be able to share my story and to let you guys know what I truly think about the trauma team. I believe that each and every one of you guys are angels working for God.
And without God and without the help of you guys, I would have never been here today. And I'm just humble and thankful that you guys did whatever it takes to keep me alive so I can be with my family. Thank you.
Is there anything anyone would like to add? Any lessons they may have learned? Any advice for others who may be going through similar?
Yes. Anyway, like I said, you just have to be so careful and everything. And like I said, I was sitting outside, and it's just terrible. I still live in the area. I've been living there 40-something years, and this never happened to me. So, yes, it was traumatizing. So you have to just be so careful because you just don't know when things like that's going to happen. And like I said, I'm 75, and when it hit me, I didn't know what really hit me. And then when it hit me, it was the most terrible experience I ever been in my life. I birthed 3 children, and one of my sons in 2001, he was shot over there in the area also, but he didn't make it. He came to Brookdale. And that's why I says I have so much faith in God, because I was never able to tell the story. But I asked God to just give me a moment with my son. And my son opened his eyes, and he was dead then, they said. But he said, "Ma, if I don't make it." And he didn't make it. He came to Brookdale also. So it's rough out here. And it's no such thing as they saying get the guns off the street. I don't believe they can do it. And I feel so bad for my little grands and great-grands growing up into this world and coming to school and going to the stores and everything. It's just rough. And you can't say you want to watch your surroundings, because I was just sitting outside. So did I think someone was just going to come and randomly shoot? No. And I fear every day. I don't go outside where I live at no more. I cry a lot of nights. Just last night, sometimes I go through the scene all over again about how it's happened and what happened. So the thing is that we all just have to thank God for being outside. And I thank God for the doctors that helped me. My doctor over there, he really worked with me. They didn't think I was going to make it either. And it's a rough world. And we just have to pray and stay together and stand together and just hope things get better.
Like Miss Ellis said, it's hard to be aware of your surroundings because you just never know. I don't tell too many people, but I was shot twice in my lifetime. Once when I was 16 and once in 2020 after I turned 33. And they both was on the same block, same area, same spot. And my aunt still lives there, and I have to walk past that spot every day. So I just pray every day. I pray for my niece. I pray for my husband, because you never know. You could be aware of your surroundings a million times, but you just never know. So you just have to pray. And that's the only thing I can think about, because like you said, you never know. You could just walk out your door and something could happen. I got shot in the height of COVID. It was Father's Day 2020. I didn't know when I walked out of my house I wasn't going to come back for 5 months. I spent 2 months here and 3 months in Phoenix rehabilitation. I couldn't feel nothing from the waist down. The first time I stood up, it was like a month and a half after I came from Brookdale, and Miss Judy was right there by my side. Every time I come to Brookdale, I have to look for Miss Judy, because I feel like I'm thankful for my doctors, but I'm extra thankful for her, because she gave me what I needed, my inspiration every day, because I couldn't have visitors for a month because of COVID, but Miss Judy came to see me every day. And I'm just so thankful for her. It was days when I didn't want to do my best at rehab, and she came to me and said, "You gotta do it." She threatened me. She said she was gonna call my aunt. She called on FaceTime plenty of days. I'm thankful for the social worker that pushed me. I'm thankful for the rehab downstairs on the second floor that came upstairs every day, even the times that I was a crazy patient and didn't want to be bothered and didn't want to get up. I'm thankful for my nurses. Again, it was COVID, so it was like a revolving door here at that time. So a lot of my surgeons and stuff aren't here. The only familiar face that I do see is Dr. Eisendorfer and Miss Judy. And I was thankful for Dr. O'Neill too, because she was here. And I remember she held my hand during one of my procedures. And the nurse came to me and was like, not too many people could have the chief hold their hand. So I was thankful for that. So I know sometimes Brookdale gets a bad rep, but I love Brookdale. And I tell everybody go to Brookdale. Y'all saved my life twice, and I'm thankful for it.
One biggest lesson I learned since I was hospitalized and been discharged is not to take life for granted. Me, I'm only 19 years old. I turned 20 next month, so I'm very grateful that I did survive and overcome my injuries, because there was a 50-50 chance that I was not gonna make it. My injuries hurting me bad. I lost a lot of weight. I lost a lot of blood. And also I was pregnant at the time too, so that was making me sick during my process and slowing down my recovery process and everything. So now I'm glad that I had the best ICU team, the best surgeon team, and that they helped me through the process. I was in there long. They do call me the miracle child because I did survive something that many people can't overcome for my age and my size and being so small and everything. But I do say don't take life for granted, because one day we could be here, next day we're not here. And it's like everybody probably know Dr. O'Neill, she helped me every day, make sure I was good every day. Even when I was discharged and came back, she made sure I was her top priority, make sure I wasn't trying to go home. And every day I was crying, depressed. I wanted to go home. I wanted to go home. I wanted to go home to my mom and everything. And she made sure that I was okay. She made sure I had ice cream. She made sure that I could, when I was able to eat, she helped me during my process a lot. And I'm very grateful that I met her. And it's sad that she's not here today, but she does hold a major part of my heart, even though, I just seen her and then, one day you don't see her again. But another lesson for me that's hard right now is walking past somewhere I got shot. I got shot outside of my building. So every day I still live there. I have to walk past and see the place that I got shot at and where I was laying at and things like that. But overall, I feel like I could overcome anything. Like I said, I'm 19 years old and I am a strong individual, as my doctors say. So I don't really talk about my trauma because I'm still in my recovery process. I still have things going on with myself that we're trying to get fixed on so I could be a healthier person. But I'm very thankful for everybody that helped me during my process, my ICU team, the nurses, the surgeons, the residents, the med students, everybody. So yeah.
I just want to say I want to thank the doctors that did the surgery on me, and the reputation of Brookdale is, I heard that it's not a good hospital to go to, but once I was here for 4 months or whatever, I could see that it could be a few bad apples, but the majority of the hospital is a pretty good staff that works together, So just because you have 1 or 2 bad apples does not mean the whole hospital is terrible. So I just want to let y'all know y'all did a good job on me and these other people sitting next to me. So I want y'all to know that we appreciate y'all um, and that um, I don't know what you call the other team, the bone doctors, orthopedics team. I'm scared of them. They did they good. They did their job, but I'm scared of them when they come in the room. They are rough. Oh man, they have me shaking. I'm like, I'm being nice to y'all. Y'all still treat me like this. But they did a good job. And the general team did a good job. And there's another team that did work on me. But everybody did a good job because I had blood transfusion. They said I could have lost my limb, but because I lost a lot of blood and everything. And I just want to say they did a good job with me, and they told me it's a possibility I might not be able to walk again, depending if my nerves were stretched or severed or whatever. So that was, I didn't take that too well. So I broke down a few times in the hospital, but with the PT staff, they dedicated their time, with me, even times where they wasn't supposed to, they came and got me. So I just want to let y'all know there are staff here that goes above and beyond, and nurses as well. Um, and uh, and I just want to say that just empathy and showing emotions to the patients goes a long way, because some patients don't feel like y'all care, and that's why sometimes it can become hostile between the patient and the doctors or the nurses, because the energy that sometimes if it's trauma, a lot of trauma with the patients that they're dealing with, and it's like sometimes if you don't know until you experience it, so some doctor could come in or nurses probably having an energy that's not a good energy to come in the room, and they go back and forth, and so I can see both sides of perspective with the doctors and nurses and the patients. So I just want to say that just try to do your best, and just show that y'all care for the patients, and sometimes those patients could probably see and say, you know what, come back to the next day and say, oh, I'm sorry for acting like that towards you or whatever, because it's like being nice goes a long way. So, but that's all I'm saying.
One thing I want to say is, like when I got shot, like flashes started happening. You know what I'm saying? And the week that I had got shot, the next day was the second anniversary of my grandmother's death. So when I was laying there on the ground, like thinking I was gonna, die, like, you feel me? Like I just got shot, so the impact happened, so like when people say, yo, how I feel to get shot, like all I felt was the impact, you know what I'm saying? Like I felt it, and next thing I know, I'm rolling back down the steps, you know what I'm saying? So I was going into conversions, on the floor, and next minute I just heard a voice like, breathe, you're gonna be okay. You know what I'm saying? So all the shaking and stuff just stopped. You get what I'm saying? So when I got to the hospital, and they told me that, you're gonna be okay, it was like, I became myself, like I'm a natural jokester, so I'm sitting in the hospital, I'm joking, and when y'all gonna get me in my room? Like, what's up? You know what I'm saying? Like, stuff like that. Like, it became to where I started joking, and the doctors was trying to get me out the hospital. You know what I'm saying? Like, yo, when are you getting discharged? I'm just like, wow. Like, y'all want me to get out that bad, you know what I'm saying? So I didn't let it affect me. Like most people will get shot and just it'll affect them, and it'll deteriorate you, you know what I'm saying? I didn't let it affect me because I knew I was doing something right. I wasn't outside. I'm not in no gang or nothing like that. I got shot from protecting people from my projects. You get what I'm saying? So I didn't look at that as no burden on me, you know what I'm saying? So I'm here for a reason. So that's how I looked at that, you know? So like I said, all of us are gun victims or accident, whatever, you know what I'm saying? But we are here for a reason, you know what I'm saying? So I appreciate seeing y'all, you know, hearing y'all story and all that, you know what I'm saying? So yeah, that's pretty much, you know what I'm saying? Yeah.
Truly inspiring stories. We also have one additional person, Mr. Lead, who is special to the Brookdale family as everybody else is, and he would like to share his story as he was also a victim of crime and was brought here nearly 20 years ago. So, Mr. Lead, would you please join us on the stage?
Hello, everyone. I just want to say I'm also a gunshot victim. First time I learned what the word, the letters GSW meant. It's weird. I was 17, just left basketball practice and went to the barbershop to get a haircut. Some local thugs had robbed somebody in the projects, came to the barbershop, was hanging out. The people in the projects found out that they were in the barbershop. They came down and shot the whole barbershop up. I got shot 3 times. A couple of my schoolmates were shot directly in their knees. My barber directly in the rectum. It was terrible. Like the brother said here, you know, when you get shot multiple times, it's weird because you feel that first impact. It's like hell. It's like, what happened? But the other bullets is like a pinch. You don't even feel it. I didn't even know I was shot that many times until I got into the ambulance. The ambulance was like, oh my God, you got shot 3 times. You know, we got to rush you to Brookdale. And I just want to say, not to get too graphic, one of the bullets had went into my hip, crossed my urinary tract, cut my urinary tract, and landed here. Dr. Gomi was the doctor that operated on me. I was afraid I would never have kids. To this day, I have 3 boys, happily married. Brookdale saved my life. I just remember just coming here, just being a patient. It was a wonderful feeling. It got me through it. You would hear all the bad things in the neighborhood. Oh, Brookdale. But I was like, nah, they saved my life. I'm good with that, you know? So I just want to appreciate and say thank you. I definitely feel what you guys are feeling. It's been over 20 years, but, you know, we move on. And definitely I understand your pain because before I was shot, I felt like I was an extrovert. After I got shot, I had to pull back from a lot of people because it just was weird. I didn't want to go out. I didn't want to go clubbing like my friends was going. I didn't want to go to the car show. I just wanted to be to myself. So it took a lot of years, and I'm still working on it. So I just want to say to the Brookdale staff, I appreciate you. I appreciate your humbleness. I appreciate all your past workers or your present workers. This has truly been a blessing because I'm alive and I get to come back here and take pictures of you guys and offer my services. And I feel good giving back. So thank you for giving me my life, and I will make you guys look pretty.
Thank you all for your bravery and your strength, and thank you for sharing your stories with us today. Those stories are really the reason that we are here and why we do what we do. So thank you again.
Next up, we have Ms. Kamara Jackson from Elite Learners, who would like to say a few words on the organization and the resources that we provide for all of our trauma patients.
Thank you so much. I'm not going to hold you. I know everyone's ready to go. But my name is Ms. Jackson. I am the founder and executive director of Elite Learners, Inc. And I could not leave here this afternoon without gracing you guys with a few words. Not only am I the founder of Elite Learners, but I am a baby of Dr. Visk, which means I am a sickle cell survivor, and I am someone that has been within the Brookdale Hospital system for a very long time. I would just like to say, when it comes to dealing with our trauma patients and just the work that we do within the community, it could not be done without the trauma department here at Brookdale, without the staff, without all of the team members here. It was a collective effort to have an organization be a part of the hospital and really provide violence prevention services. When it comes down to gun violence, it's difficult. It's a hard situation. We don't know what, where, when, why, how. A lot of times it's just us reacting and performing. And I want to say to Miss Kathy, before you leave, you had a whole city behind you. Little did you know, the organization responded to the scene. We were here when you got here. We checked on you. We prayed for you. You had a whole city behind you. And usually that's what it's looked like. It's individuals that are making connections and making ways to make sure that our trauma patients receive the best care, receive the services and the support that they need, not only while they're here, but when they leave. And that's the job of the organization. That's the job of the people that are here daily. I have Mr. Jones. I know everyone in the hospital knows Mr. Jones and Mr. Jackson. But literally, it's a group effort. It's a group effort. And I will say, many people have quoted the reputation on the street, but I am here to tell you the reputation has changed. We have seen people in the midst of gun violence say, I'm going to Brookdale. Okay, so leave here with that. Know that for the past 7-8 years, the trauma team has been amazing, and amazing things are happening for our small community hospital. So I thank you all for continuing the fight. I appreciate Sharon and both Nicole's and everyone, and Judy, you know, we've been through thick and thin to make sure that we fight for resources for our Brownsville community-based hospital. So special thanks to all of our survivors, and thank you again on behalf of Elite Learners.
Next up, we have the honor of introducing Ms. LaRae Brown to the stage, our CEO of One Brooklyn Health. Without her strong leadership, our organizations wouldn't be where they are today. Ms. LaRae Brown.
Thank you very much. As I was sitting here hearing the stories, all I could think of was humility. Because we all, I believe, have to be moved by the stories of the folks who have survived, And I also, all I could think of was, I hope we're taping this, because the people who need to make policy and budget decisions need to hear these stories, right? I appreciate what everyone has said about the reputation of Brookdale. But what I want is to make sure that the folks who make decisions in Albany and in Washington hear the stories of the people who have lived because of Brookdale, and hear the stories about the staff who have contributed to the success of the folks who have survived. And we will continue to prevail. We will all fight for this hospital, for the One Brooklyn Health, and as importantly, for everyone who lives in Central Brooklyn, because everyone deserves the best care possible, and everyone deserves the respect of a safe community. So I pledge to you that all of the hours that I will spend will be about bringing the stories of you all as heroes, the heroes of our surgeons, the heroes who are our nurses, the heroes who are the support staff, the heroes of our partners, and most importantly, the heroes who are our patients. Thank you so much.
We just want to give a special shout out to the people at Central Brooklyn Development Corp., LaShawn Mohammadi, and the people at Brooklyn Chamber of Commerce. Thank you for helping making all of this possible. Would you like to join us on the stage, please, for a few words?
Thank you. Thank you.
We're going to be brief. Good afternoon, everyone. I am so full right now. I'm looking at this is terrible. My first boss, Lorraine Brown, when I worked at Health and Hospitals for 25 years. And I guess I should introduce myself. I'm so sorry. LaShawn Muhammad. I serve as the Executive Director of Central Brooklyn Economic Development Corporation. It's a proud hyperlocal nonprofit organization that has served this community and the Central Brooklyn community for the past 34 years. Our job is literally to support community residents to seek and find pathways to self-sufficiency. And I was born in this hospital. I was raised in Tilden houses, not far from here. This is home. And so this is a blessing to be able to be a part of what you all have built here. Our role in collaboration with the Brooklyn Chamber of Commerce will be to support the future heroes, the young people who will become the future nurses, the doctors, right? Because we have to make sure that we continue to build the pipelines to keep this hospital strong in serving this community. So I say all that to say, when I was 20-something years old, a few years ago, I was supposed to work for Lorraine for 3 days as a temp. And this is why mentorship is so important. This woman right here from day one, and they told me on the last day, you keep coming until we tell you to stop coming. I was there for 25 years. So it's important. So thank you. And I'll now pass it to my colleague, Cabral.
Hello, everyone. I would like to say it's an honor to be here. I'm so new to New York, and just seeing the impact and the love that you all are sharing and the stories, it's just phenomenal. So I'm Cabral McCahan. I work at the Brooklyn Chamber of Commerce. I'm the Workforce Development Manager. And as LaShawn mentioned, we will be doing a lot of work together with you all just to make sure that we're providing opportunities. So workforce development is so important. Having a job, having a sustainable income, equitable jobs, that's so important. It's a passion of mine. So that's what I do at the Brooklyn Chamber of Commerce. We also do a lot with small businesses and entrepreneurship. So anyone that's looking to getting into entrepreneurship, or if you have a small business that you want to help thrive or push, definitely contact me. We have a table outside, and I look forward to working with you all.
As we conclude, I would like to extend a heartfelt thanks for joining us in celebration of our survivors. I would like to recognize Sharon Lead and her exceptional team for their tireless efforts in organizing this event. Sharon and Nicole, please accept our sincerest thanks for your tremendous impact. We also extend our dearest gratitude to all the departments that contribute to the success of our team, from our skilled physician teams to the compassionate caregivers who offer solace and support. Every member of the OBH family plays an integral role in the lives of our patients. Once again, thank you for joining us today and for your support and for being part of the celebration of resilience and hope. Please feel free to join us in the garden where lunch will be served. Thank you.